Yeah, I was just wondering about how do you approach different types of sampling? Like how do you if you have an unknown ILD walking into your clinic, how do you decide whether you're going to do a transbronch, cryo, or kind of surgical lung biopsy, and kind of what influences those decisions?
Yeah, so sometimes it's based off the CT pattern and what the CT sort of most closely represents. And if we think that we can get it on a transbronchial biopsy, which is sort of the least invasive, right? Oftentimes we can get sarcoidosis or non-fibrotic, or we used to call acute HP. Like we can often get that on a transbronch. Some of the more like airway-centric diseases where can get away with a blind biopsy, semi-blind biopsy. Um, you know, Surgical lung biopsy, is sometimes necessary in the more sort of challenging cases. I think that oftentimes we bring them to MDD and we talk to the radiologist and the pathologist and say, like, what do we think we can get? Like, what do we think we need to do here? And some of it's based on patient factors, right? Like, are you well enough that you can tolerate a surgical lung biopsy, right? Can you tolerate the general anesthesia? Can you tolerate the inherent pneumothorax when you do a surgical lung biopsy, single lung ventilation, that kind of thing, let alone the recovery from it. And then also, sometimes the patients don't want to undergo, heavy surgical procedures. And so it's really like a multifaceted approach to the biopsy.
Now, let's myself, I've noticed that in our institution that surgical lung biopsies have gone down. Anecdotally, I see less and less of surgical biopsies and cryobiopsies are going up. And both Sharda and Irene practice very much in a cryobiopsy heavy kind of practice. So my question to you is, do you notice anecdotally any difference in the diagnostic yield as we are moving towards cryobiopsy? Or do you think surgical biopsies were better in any way? Or do you have any cases where the cryo doesn't give an answer, but the surgical does? How do you see the diagnostic yield versus in practice, like in real life, has it made any
Yeah,
difference?
I think that I think that there is a large role for cryo. I think that we are making diagnoses based off of cryobiopsies, and it is less invasive than a surgical lung biopsy. Um, I think that at our institution, the surgical lung biopsies are incredibly safe. Our surgeons are fantastic. But if the patient doesn't need to be in the hospital with a chest tube, even for a few hours, let alone overnight, um, and we can avoid it, um, I think that there is a role for cryo. Are there cases where the cryo sort of quote unquote misses it? Yeah, I think there are. It's still a blind biopsy. At least when you're doing a surgical lung biopsy, the surgeon's in there looking at the lung and can grossly see what looks normal, what looks, in the middle, and what looks mostly abnormal. And so I think there's going to be a role for surgical lung biopsy always. But I do agree with you that I think our cases are going down in general.
Yeah.
The other time I tend to lean towards a surgical is if I've already done a transbronch and didn't get an answer. I hate to send someone for three procedures. I hate to do a one bronch and then a second bronch and then a surgical lung biopsy.
Yeah.
And from a patient perspective, they're like, wait a second, you did a bronch, you didn't get an answer, and now you're going to go do another one. Like, why is that, right? Repeating the same thing over and
Yeah.
the same result, kind of a thing.
Yeah.
And so I think there will always be a role for surgical biopsies.
Yeah. Matt, anything else?
Yeah, no, that's great. Yeah, we do very few cryos here, it's mainly surgical biopsies. So it's interesting to see how things differ and the roles. But some of the things I've seen, I think the cryos work quite well.